I'm Stephen Brushwood. I'm the medical director for Freudenthal Hospice. I've been doing hospice or worked in hospice now for about 16 years. I just want to talk a little bit about the hospice benefit. Hospice is a benefit of Medicare or your commercial insurance. Whenever you become hospice appropriate and decide that you're ready to come on to hospice, essentially you just elect that benefit. The eligibility for when you qualify for hospice is determined by criteria set forth essentially by Medicare. So hospice is both a benefit of Medicare or your commercial insurance as well as an actual benefit. It is simply a benefit to the patient. If you meet the criteria that Medicare has set forth for hospice, I would really encourage you to utilize that hospice benefit because the focus of care is different. And very often, I would say almost always, we're generally going to help folks or help everybody to feel better and very commonly help them to be much more functional because, again, our focus is on those two things and not let me try to fix this underlying cancer or let me try to fix this underlying heart problem or a kidney issue or that is not the focus of care when we're on hospice. Hospice, unfortunately, is underutilized basically because folks have an idea of hospice that basically I'm going on hospice to die. And the reality is that we really can help to provide certainly quality of life and not uncommonly some quantity of life. Had a patient that came on primarily related to cardiovascular issues, mostly heart, basically heart disease. And she was really not able to function very well. She was not able to get out of bed very much. She just felt really poorly. And because our focus, again, is on comfort and helping her to be as functional as possible, going through several of her medications, and she was on medications that we would typically see patients who have chronic coronary artery disease and chronic congestive heart failure, those sorts of things on. But because of the focus, again, being different, we started really going through those medications and realized that a lot of her not feeling well started with a couple of those medications. And so when we pulled those medications away because of the fact they were making her not feel well, she actually began to get better and better and stronger, and where we realized, hey, right now you really could improve and get back on your feet and be functional and really probably graduate from hospice, at least for now. And we really think that's the appropriate thing to do. So she was discharged from service because she was feeling so well. And she went on to basically go and spend time with her family and travel in the country and doing a number of things for the next couple of years until then the natural process of her underlying heart disease caught back up to her and she came back on service. Essentially, because of the difference in the focus of the care, we really ended up providing her hope and functionality and then essentially she credited, she could not say enough times that we basically gave her 2 years of life that she didn't expect to have, that she really treasured, but she really praised the work we had done with her and the fact that we gave her 2 years that she was able to go focus on quality time with family and doing the things she really wanted to accomplish in life before ultimately she passed. So that was a really fantastic feeling to be part of that as well. People will say to me periodically, they'll say, I'll say, I've been doing hospice now for 16 years. And they say, that must be really hard work. And I say, you know what? I really enjoy the work. I said, hospice is really a blessing. And people kind of look at me odd, like they're like, well, what do you mean hospice is a blessing? I said, well, if you go outside and suddenly drop of a heart attack, or you get in an accident and suddenly die, you didn't get to prepare for your death. I said, hospice gives you the opportunity to prepare for your death, to try to work on completing the things you want to complete before you pass, to reconcile reconcile those relationships that you really needed to reconcile, and and to really go out peacefully. So to recognize that your time is coming, and that you have now the opportunity to prepare for that and guide that and make decisions related to that and prepare your family and your friends. It is a tremendous blessing to be able to utilize and recognize hospice.